Here you are watching drug-induced sleep endoscopy with DISE monitoring in a 55-year-old male with history of disturbed sleep, snoring, choking, but he cannot get his sleep study done properly because he cannot sleep with the wires and with the machine. You can see his deviated septum on the left side, the high DNS to the left, and you can see this far on the right. There is a blocked nose. His body mass index is 31. There is a little obese, and his AHI on whatever sleep study could be possible was 9.3. So obviously, because he could not sleep, so it's not a correct measure. You can see the turbinate hypertrophy on both sides, which has already been decongested. In the nasopharynx, there are no adenoids. Salpingopharyngeal folds are grade 1 by Eglos classification, which is 25 to 75%. You can see some post-nasal drip. You can see I was already snoring. This is around 65. You can see palatal and epiglottic collapse. Very classic primary epiglottic collapse, and that is the reason he is unable to use CPAP. So in the palate, he has majorly the lateral collapse. We'll wait for the BIS to come to 70s because right now we are in the 60 range of BIS. So the epiglottic collapse could be because of knowledge also. But one thing is clear that in spite of his BMI, his tongue base is not really large. It's majorly a lateral collapse of the soft palate. The epiglottis is not collapsing too much now, which it was collapsing initially. So at least we are convinced that he does not have that much of sleep apnea anyway, because in spite of the BIS being at 60, he is only snoring. He is not completely collapsing. So as we understand, he is majorly a case of mild sleep apnea at the most. His AHI 9, we can consider it to be realistic, and with the nose itself, his sleep issues will become better. He'll still keep on snoring, and if at all required, in the second stage, we can perform a suspension bridge pharyngoplasty to take care of the mild sleep apnea and snoring. You can see that at the base of 60, he does not have a long-standing collapse. His airway is not completely collapsing; it's only vibrating. All right, so we are convinced that is a case of mild sleep apnea. So, a sleep study of 9.2 we can accept as realistic. Now, the base is in the range of 65-70. So his obesity has to be taken care of, his nose has to be operated. The snoring will still remain, but once we do his nose, which is septoplasty, turnoplasty, he will definitely improve in terms of airway resistance, but will sleep better than what he's sleeping. Thank you for watching.